Hello, I'm Dr. Elizabeth Coyne and I'm going to present A1 for 7202 Advanced Practice in Nursing. So this assessment item wants you to look at the advanced practice nurse in your clinical area. Look at the history, in that area, the development of this role, and use it in your own clinical context. So that'll be easier because the whole A2 and A3 will then flow from this. If you're not working in a clinical area which doesn't have any advanced practice roles, then you can use just a general role, a general advanced practice role from another area. So I want you to summarise this advanced practice role and look at sort of this role in relation to the domains of practice, and then conclude with some recommendations for further practice improvements. So the historical development, start with a short introduction sentence just to give us the context of your area and your advanced practice role, and then to discuss the development of this role. And so in particular you might sort of look at where there was a reason for this role development. There was maybe a sort of increase of patient concerns, poor education of staff, lack of awareness of some particular clinical point. And so this is why this role was then developed. Look at the cost factors in relation to this role and how it was developed, the changes, were there any barriers and enablers to changing this role, and who were the sort of different people that were involved. Some of the roles that have come up in the past are looking at sort of the advanced practice role in emergency or paediatrics, also the discharge clinical nurse consultants and specialists in other areas as well. So I want you to summarise this advanced practice role and really look at sort of what population do they see, why do they see them, what is their main roles and the justification for those roles, what have they developed particular aspects of this role over time, and really use the supporting references. So this will be sort of like best practice of the development of this role or the particular aspects they do within this role. And then I want you to link this to domains of advanced practice. So look at those domains in relation to education, leadership, clinical expertise and research. So what does your advanced practice nurse do, or what do you do in this advanced practice role in relation to these domains of advanced practice? And so sort of aspects like, what education do they provide? Do they go to conferences? Do they have a clinical role or particularly relates to leadership or mentoring of staff or development of clinical roles and clinical education with patients? And conclude by making an evaluative statement and recommendations for the further development of this role in your area. And so when we're thinking back to these four domains, education, research, leadership and clinical, and sort of how they may work in this in relation to assessment, planning, implementation and evaluation of their role. Thank you.